Maybe you have seen this before. Downtown, someone acting in a way that seems completely out of touch with reality, talking loudly to themselves, shouting at no one, pacing or waving their arms. To most people, it looks like madness, but here's the truth. What you are seeing might be the result of something far deeper. A head injury years ago, an emotional trauma that never recovered from, an infection in childhood, or years of chemical exposure at work. Any of these can change the brain's structure or function, and it can lead to depression, bipolar disorder, schizophrenia, or other serious mental illness. The real story is in the brain. And here's the challenge. It's not like cardiology where the blocked artery shows up clearly on a scan. We can't take a picture in a brain and say, this right here is your depression, because depression isn't a one single. It can involve different brain regions, multiple neurotransmitters, and dozens of receptor systems all tangled together. Antidepressants that work in completely different ways can all be effective. Even our diagnostic tools reflect this complexity. In a DSM-5 and PHQ-9, you need at least 5 out of 9 symptoms to be diagnosed, but 2 are non-negotiable: low mood and anhedonia, loss of interest or pleasure. The rest, they can be any mixed changes in sleep, appetite, energy, concentration, self-worth, movement. The rest, they can be any mix. Changes in sleep, appetite, energy, concentration, self-worth, movement speed, or suicidal thoughts. That means over 100 different symptoms combination can all be called depression. There are still many gaps in how we understand and treat mental illness. In this series, 1000 key points in a treatment of depression, we focus on the two biggest puzzle pieces. The first is pharmacotherapy, everything about medicine and how we use them to treat depression. The second is a psychotherapy. The psychological and behavioral approaches can be just as important as medication. I also share a third puzzle piece: complementary treatment, new and emerging approaches that can enhance traditional care. Here's the truth: there are still many puzzle pieces missing, part of mental illness or we haven't fully understood, diagnosed, or treated. And together, we'll explore these gaps and work to find missing pieces. Follow me. Thank you.